A 14-year-old has built a smartphone app that listens to your heartbeat. Could this actually change how we fight heart disease, not just locally, but around the world?
Let's get into it. The date today is 2025, 5/26. Siddharth Nandiala, just 14 years old, has developed Circadian AI, a smartphone app that says it can detect heart disease in 7 seconds. That's not science fiction, right?
No, it's real. The app uses your phone's microphone to record heart sounds, then analyzes them with AI. It checks for the acoustic patterns linked to over 40 heart conditions. What really stands out is the early, non-invasive detection. You don't need an ECG or an echo, just a smartphone.
That's a big step forward, especially in areas without hospitals or specialists nearby. But how reliable is it? I mean, can it really pick up on things as well as standard tests?
Circadian AI was tested on over 15,000 patients in the US and more than 700 in India. The reported accuracy was over 96%, so it caught cases that standard tests sometimes missed, particularly in the early stages when treatment matters most.
Those are strong results, but I'm thinking about everyday use. Hospitals can be noisy, and homes even more so. How did they deal with background noise?
That's actually one of the technical breakthroughs. Siddharth and his team built advanced noise cancellation into the app. It can filter out background sounds, like traffic or chatter in a waiting room, so it still picks up the important heart sounds for analysis.
Building an algorithm that works for different ages and backgrounds, that's not easy. Did they test it with, say, children as well as older adults?
They did. The trials included a wide mix of ages, ethnicities, and medical histories. Major hospitals took part, like Guntur Government General Hospital, which sees a really diverse range of patients. That diversity is key when you want an AI tool to be used globally.
There's also the privacy angle. Health data is sensitive. How are they handling that?
That's a big concern as they move toward regulatory approval and scaling up. The team is building in strong privacy protections, things like data encryption, clear user consent, and making sure they follow health data laws. That'll be crucial as more people start using it.
Are they planning to stick with heart disease? Or could this technology be used for other conditions too?
The technology could be adapted for other diseases, like respiratory issues. For now, heart disease is the focus. But the bigger idea is using simple tech, a phone mic, plus AI to check for health risks that usually need expensive machines.
And there's the story itself. Siddharth is the world's youngest AI-certified professional, recognized by Obama, Biden, and the Andhra Pradesh Chief Minister. But the real point is access, isn't it? Can this actually help close the healthcare gap?
That's what makes it so interesting. Cardiovascular disease is responsible for 1 in 3 deaths worldwide, and millions lack early diagnosis. If a phone app can reliably screen people anywhere, that's a real move toward fairer healthcare. It's young innovation meeting a real global need.
So, a 14-year-old simple question, why don't we catch heart disease sooner, ends up sparking a global response. It's a mix of AI, accessible technology, and a new way of thinking about an old problem.
Exactly. Circadian AI could make checking your heart as easy as recording a voice memo. The next steps, regulatory approval, scaling, and maybe adapting to new conditions, will be important to watch.
That's where we'll stop for today. A teenager, an app, and a chance to change global heart health. What comes next is anyone's guess.
Thanks for listening. This episode was brought to you by mynews.studio. Try it now for free.